In today's episode, I want to share a story not from a dental chair, but from my own business and how we navigate one of the hardest parts of a business, people. And to help me discuss that, we have Dr. Jimmi Patel here. Hi, Jimmy. Welcome to the show.
Hello, Kritika. Thank you for having me today.
So, today I'm going to have a chat about a scenario that you are very well familiar with in our practice. So, as you know, that how the most difficult part in a business or in a health profession is dealing with people, right? People management is the hardest part. And last year we found this perfect company who started to help us, and we were aligned with in values. We were aligned in what we wanted to achieve, and they were aligned completely with us where we were and where we wanted to be.
Yep.
And it was on that day, I remember it was like a dream had come to reality when we both walked out after the dinner with the ladies from the company.
Yep.
And one of the ladies in there was Courtney.
Yep.
Every time I spoke to Courtney, I felt like, oh my God, like this person just really gets me.
Mhm.
And, you know, even like our manager, Katie, like she and her, myself and Courtney were like all on the same page. Like I could call her up during the day and she would have a solution for me. And half the time I didn't even have to complete my sentence. We just knew what Courtney was going to do. She was pretty much on a fast dial on my phone,
Mhm.
right? And the whole dream was perfect, right? And then come, you know, December, January, February, and you know, she was training me how I need to act like a leader, and you know, Katie should be managing all the day-to-day HR solutions, and it was all going fantastic until Easter.
I do know that. Yes.
Yeah. So Easter, 2 weeks after Easter, I'm trying to call up Courtney. I get no response. And I'm trying to get in touch with all the jobs that we were going to do in terms of our HR. I just can't get hold of her. And anyway, and you know, I just kept thinking, look, maybe they're having an extended holiday,
Yep.
or maybe Courtney's not there, or you know, whatever. Because she was actually moving houses at the time as well. So I was like, right, that's okay. She must be busy with that. I'm sure she'll get in touch. And all of a sudden, I get a phone call from the company, and I have this person on the other side whose name is Josh. So, and I say, oh, well, I need to speak to Courtney. Like, I need to know where we are heading. And he's like, sorry, Kritika, but Courtney doesn't
There is
work
no
with
Courtney.
us. Yeah,
Yes.
doesn't work with us anymore. And that the world just stopped for me. Courtney was an employee at that company. She was not the owner of the company. The other lady who I walked out with, who we both walked out of, you know, from the restaurant after having dinner with them, she was the owner. But that didn't really concern me. All I wanted was Courtney,
Yep.
right? And she wasn't there. And I was like, what do you mean Courtney's not there? He's like, yep, she's not there, but I have replaced Courtney. And I said, but I don't want to deal with you. I actually want to speak to Courtney because she knew it all. She knew me. She knew Katie. She knew
Our business.
our business, the
people,
pulse,
yep.
the people. She had actually come and visited our practices.
Yep.
And I was like, but she knows us and you haven't. And he's like, I understand. And after that, Josh just said, look, let's have a meeting, online meeting, and we can have a discussion about where you are at and what are your needs right now. What do you need, or what are the jobs that you have been waiting for? So I sit on the computer screen, like on a Zoom call with him, and he's telling me he's very structured, completely opposite to Courtney. Courtney was very fluid, very emotional, right?
Yes.
Whereas Josh is extremely structured. He's going step by step, and you know. And I said, look, this is not how I'm used to dealing with. I want to talk about more how I'm feeling emotionally with my team or what's going on. And he's like, I get all that, but I want to know what are the deliverables that I am meant to give you, and let's get on with it, you know. And I said, right, so when can I call you up if I have a problem? Because Courtney used to call me up at the end of the day and she would give me a debrief, not during the day. And he's like, yep, I will actually forward you a meeting link and you can actually make a meeting with me and we can go from there. And I'm like, right. And then every time I'm talking to him, I'm like, look, Josh, I understand you are very structured, but I just don't like this. I don't understand. I don't understand your working style. And I don't think we are going to be a good fit. I really think that I need to speak to the boss. Okay. And he just kept saying, I understand that, Kritika, but give me the tasks that you want me to give. Anyway, so I'm just not happy. Every now and then I'll go and call him up and I'll give him hard time and then I'll hang up. And this one day when I actually acted out of my character and I was rude to him over the phone. Actually had a moment. I stopped and I said, did I actually just do that? Like, don't I get patients like that in the clinic or I have had patients like that who have actually said to me, I don't want to see you, or I want to see another dentist, or I want to see Jimmy, I don't want to see you.
The person they used to see.
They used to see, right? And how do I take that personally? And I'm actually doing that with Josh.
Mm-hmm.
I don't know Josh. I am not giving him enough opportunity to prove himself, but I am behaving this way.
Mm-hmm.
So I just want to understand or unpack this with you a little bit about this resistance that in our scenario, in a health professional setup,
Yep.
patients have this, they develop this resistance or they show this pushback towards the health professional and say, I don't want to see you. Why do you think they do that? Like, yeah, what do you think make them do that? Like, even if I would like to know you because I want to kind of stitch it in with how I was feeling when I could not have Courtney and I had to deal with Josh.
Yep. So my take is very simple, and that is, and I'm only going to speak from our professional
Yeah, of course.
point of view.
Yeah.
And that is, especially in any sort of client and service provider relationship, and especially it's even more important in terms of the healthcare provider. So the relationship between the healthcare provider and the patient, in my opinion, is based on only two things, and that is, first of all, the easiness of communication, and then that builds to the trust.
Yeah.
And then everything else becomes easy after that. So those two things are the most important part. Because when you really think of it, patients are sharing some of the most intimate information about their body, about their health, about their personal life to their healthcare provider. And when you think of it, that piece of information only the most intimate people know about ourselves, right?
Yeah.
Your partners, your mom and
Family,
dad, the closest of the family.
Yeah.
You know, sometimes we don't even share what's happening with our health and our body to our own siblings as well.
Yeah.
Or to our kids as well.
Yeah.
So why is that? Because it is extremely sort of intimate information, and then you only share with people who you really have to share or feel extremely comfortable sharing. So from that point of view, the easiness of communication has to be there, and the trust has to be there. That's the first part of this
Puzzle.
of the puzzle.
Yeah.
Why patients sometimes get very stuck on, I want to see the same person. And the second thing is, especially in our profession, and there are other health professionals as well, where the delivery of the service that we do to our clients, to our patients, is extremely intimate in their space as well, and not just emotionally, because they are sharing all this information with us, but physically in our case as well, because when we treat our clients, they are literally in our laps. You are very close to them. You are very close to their face. The eye contact for me is the big one, which is
They're just
you,
there.
the distance between the eyes, their eyes and our eyes is just less than 1 feet sometime. And,
Yeah.
and that is super close, on the face. You are breathing on each other.
Of course. Yeah.
So it is extremely difficult scenario for the patients to be in.
Yeah.
They are being super vulnerable for someone to let like, put their hands in their mouth and be so close to their face and their
Yeah.
eyes. So yeah, it is hard. It is super challenging.
It's kind of, they are like surrendering themselves to you,
Yes,
isn't it? Yeah.
yes, absolutely. And as health professionals, of course, we have to respect and value that, but we also have to respect the fact that it's not going to happen very easily and very quickly for so many of our clients. They're going to take time. And once the patient become comfortable with, in our case, with a dentist, or in other cases, any health professional, they're not going to let that relationship go that easily because they found that comfort of sharing information and found that trust that it's not going to sort of um, be dealt with in a bad way, that information. So when they see all of a sudden, for
Yeah.
whatever reason, in this case, like the scenario of Courtney and Josh, if they see the health professional is no longer available anymore,
Yeah.
they are going to act out in
Out
a
of
way which is out
personality.
of their personality.
Yeah.
And as health professionals, we just need to respect and understand that and then go from there. So that's the only way I can think that why you also behaved the way you did with Josh, because you were so comfortable. And HR is the same. It's not same, but it's a people management thing. There is a lot of trust involved. There
Yeah.
is a lot of vulnerability involved in terms of sharing information about your opinion about other people. So when that happened, it's very easy. And I do remember you were very uneasy. I was uneasy as well. And I almost saw that our relationship with that company would probably end because Courtney was no longer available.
Longer there. It was, yeah.
So yeah,
exactly.
that's my take on that.
Yeah.
That why we act the way we did.
So, Jimmy, you talk about trust, right?
Yes.
I just want to break down the levels at what opportunities we have to like prove ourselves with the patient. And in this case, when if I kind of relate this with Courtney, I see that why I was so attached to Courtney, because I felt like she was my point of introduction. Then she was my point of problem, of picking the problems that I was seeing,
Yep.
and then creating a little journey for me, that where do I see the light at the end of the tunnel. So do you draw any similarities, or can you draw any similarities for me, like where the patient would be forming that trust, what stages we would have to really like prove ourselves at?
Speaking from, again, our professional's point of view, is that, like, again, this is what we both say to our young clinicians, is that there are 4 sort of main journey piece
Touch points.
or touch point,
Yeah.
or parts of the movie,
Yeah.
for the patient. For us, part 1 is we have to be, first of all, good at diagnosing.
Yeah.
And that comes with knowledge.
Yeah.
And then once the diagnosis is done, then comes the action plan. We have to create a plan, and not only just create a plan, but we have to communicate that plan in the most empathetic and connecting way to our patients as well.
And even like customize that plan to what the patient's primary need is, right? Like
Yes,
if it's
of
a
course.
cost, you have
It's
to,
always a balance between need and want.
Yeah, and the cost,
Yes.
yeah.
So
Yeah.
so yeah, you have to then communicate that, make it, and then communicate it with
Yeah.
our clients. And then the third part of the journey is that execution. Now, this is what universities are really good at teaching us, which is execution piece.
Yeah.
That, okay, now this is how you do A, B, C, D procedures. And that's a hard skill. That's
Yeah.
the one. And that's the execution. Again, we are not good at it like 100% from day one, but
Yeah.
you just keep honing that skill
Yeah.
over and over again.
Yeah.
And then the fourth is, once everything is executed, you have to then take them through the journey, which is the post-op journey of building the relationship, that, okay, now we have completed everything and I'm here for you whenever you need me, because that's the tough one. Because so many times as clinicians, we think that, okay, now I'm done with this part and I'm done, but that's where the
Yeah.
relationship really
Starts.
starts, or the responsibility really starts, that, okay, now I have done it.
Yeah.
This is the test of time for me now,
Yeah.
that, okay, what I've done, I back it up for 5, 10, 15, 20 years.
Yeah.
So they are the four main pieces. And each step, because there are health professionals and other professions where, you don't have this many breakdowns, like GPs, for example. They need to be good at diagnosing and communicating, because most of their execution is happening either in the form of medication
Yeah.
or other health professionals doing procedures, right? But we don't have that luxury. We are sort of more like the
We go from
surgeons.
start to finish. Yeah.
Yes, we are start to finish
Yeah.
for most of the things that we do. And that's why understanding each aspect really well, and breaking it down in your head first, that, okay, how, where you are with each patient,
Yeah.
and then taking the patient through the entire journey piece is equally important. And building relationship, there are different levels of it, that,
Course, yeah.
you have to start very slow at the first part, and then you can fast track the decision making process as you build more and more relationship
Yeah.
with the patient. But yes, it's a slow, steady process.
Yeah. And I think, like, I feel like that usually, when I was dealing with the HR company, like, they will flag me anything that was risky or not right way at the start, and I feel like that really, like, build that sort of a rapport. And I think it's the same thing in us as well, that when we are outlining the treatment plan to the patient,
Yeah.
I think that communication piece, where we actually tell them what can go wrong and what can go right, and how does the long how does the prognosis of this particular treatment looks like, I think that helps that trust piece as well.
Of
Do you
course,
think?
it's the honesty is number
Yeah.
one, and how much honesty is also important. And when I say how much honesty, I'm not talking here that, you don't be 100% honest, but it's like how much
Information, yeah.
is you have to be very selective in that. Some patients want to know more, some patient wants to know less, so you have to really understand those things.
Yeah.
Because trust building doesn't mean that I'm going to tell you everything on day one,
Yeah.
because if anything, that
It's
can really,
overwhelming.
it's
Yeah.
overwhelming. Yes.
Yeah.
So it can put people off, because you are not really, warming it before you hit it. So it's not going to bend. So you have to really slowly and steadily work on it.
Drip feed it.
And
Yeah.
then you're going to get your opportunities to then do things your way eventually. Yeah.
Yeah.
This is amazing, and we've talked about it, but I just want to know what happened with Josh. How did you go there?
Yeah. So as I, as I was actually talking, like, giving him hard time on the phone,
Yes, you were.
and I must say that on the other end, when I look at like now in retrospect, he stood there like a wall. He would constantly tell me that I am going to deliver what the company has promised you, right? And we are going to keep moving this HR department in a positive forward direction.
Yeah.
Right? He gave me a lot of confidence, but in a structured way, right? And this is where my problem was. But yeah, look, he, in my last meeting with him, when I say last meeting, is the meeting just before I manually flicked the switch that, look, Kritika, you have to work with Josh. He means well. He knows what he's doing. He actually told me, he said, I'm not Courtney, and I'm not going to be Courtney because I'm Josh.
Yes.
So I think that really made me think that that's right. I need to move on, right? If he is doing the right thing, and if my gut is telling me that he means well, he's coming from the right place, he's listening to me, he's being respectful to me. In fact, I am not being respectful,
Well, yeah.
and I need to give him a try. I need to give him
Yeah.
a chance. So I think when, again, like coming from our side again,
Yeah.
like when patients tell us that we don't want to see you, I want to see somebody else.
Yeah.
First of all, like, has this happened with you? I just want to know if you have a story for me, like, or for the listeners, like, how did you switch yourself to Josh mode?
Yeah, it happens to all of us. At the end of the day, we are if you work in the profession long enough, you are going to see patients who do not want to see you because they are just so comfortable with another clinician. And you just have to understand where they're coming from, which is what we just discussed. But then you have to respect who you are, your fabric, your style. And similar to what Josh did, is that you can only control the controllables at that point in time, what's
Yeah.
in your hand. So there was HR problem in place, and you need to only, or he needed to only control the solution of that, and back it up with the right communication and explanation
And
and
methods.
method.
Yeah.
So same goes for us, which is if your patient want you to be someone else,
Yeah.
which you can't be that person, but what you can be is the person who provides the same solution with your own style, and in a caring manner. Okay.
Empathy. Yeah.
And sooner or later, that person, which is the patient, will start seeing your right intention, and they will start
They will move
accepting
on.
you as a new norm for them.
Yeah.
And this is where you have to sort of explain that those stages, as we discussed, that okay, the communication, which is the stage 2, every recommendation has to be backed with the care, with empathy, and the why, and then back it up with good execution, and then everything will just start flowing from there. So you have to focus on what you can control, and let it all just take its course. Okay, so that's
Do you tailor any of this, Jimmy, when like with different type of patients in the jail, or is it like one size fits all?
No, one size never fits
Yeah,
all,
yeah.
especially in our industry.
Yeah.
Of course, I do, or
Yeah.
we all do change our style to some degree, but never. This is my recommendation again. I never recommend any clinician to go out of their style to the point where they are,
Not themselves.
they are not themselves, because it's a risky territory.
Yeah.
It's because authenticity wins the trust. That's the number one piece, as we discussed earlier.
Yeah.
And when you are not being true to yourself and authentic yourself,
Yeah.
people can pick very easily.
Yeah.
And that's going to harm the trust eventually,
Yeah.
right? And it goes both ways. Yes, you are changing your style to accommodate individuals' need, but at the same time, if you think that you are forced to do something way out of your comfort zone, you have to acknowledge that, communicate that, and patients will respect that. Okay, this is not something that you feel comfortable, and they will make a decision whether they want to stay with you or find another clinician. And that again will still build the relationship between the you two. Whether the professional relationship continues or not, that's a second story. But yes, you will at least maintain or build the trust. Okay.
Because technically, if you think about it, like if you are doing well with 70 to 80% of your patients,
Yeah.
you are winning. Because at the end of the day, we need to also understand that not every patient is meant to go along with me or get along with me, and not every client I am going to get along with, because there are going to be normal personality differences that we face day to day anyway. So why
That's
would
correct.
this scenario be any different? Because at the end of the day, we work on people, not just teeth or
Yeah.
any other health profession from that perspective.
Yeah. Not everyone's going to be for you,
No.
the right person. And And long time ago, when I was like in my second or third year of practice, one of the elderly gentlemen, I remember he was booked in the sort of towards the end of the day.
Yeah.
And as he was walking out
Yeah.
at the end of his appointment, he just said that one more happy customer. And I didn't sort of get it, but I figured that he was happy with me. And I just said, what do you mean? And he just said that, oh, I mean that, if you see, 10 people, if 7 or 8 of them are happy
Yeah.
or 9 of them are happy, you are building your business or your reputation. And that sort of made so much sense
Yeah.
that, as long as the number is that, that higher 70s or 80s or even 60s sometimes, that's not a bad way to be, because at the end of the day, you are doing more good than bad.
Yeah.
Sometimes you're going to have weeks or months or days where you're just not winning.
Yeah.
But that's a different conversation altogether. But yeah, if you respect all of these basics of numbers, which is you're not going to win everyone, do good most of the time.
Yeah.
It's just eventually just going to all come together.
Yeah. Yeah, that's true. While we are talking about this just really makes me think that, if there is a young clinician who is listening to this and they're driving to work in the morning and they're just feeling really deflated about their day and thinking that I'm going to get another day where all these patients or support staff is going to compare me to my predecessor and say, you're not as good as him. I really want to see him. Or you will get few cancellations that because your predecessor has moved out, and you'll just go and you'll be like, why am I even
How
here?
do you handle this?
Yeah. So let's wind back in our journey and see how we mapped this path out, because we've been in those shoes, not just once. We've been in those shoes few times.
Yes.
Yeah. So what do you what's coming to your mind straight up?
Lots. It's super hard as young clinicians. It's super hard to go to work every morning with enthusiasm, knowing that you are not only going to face challenges with your professional skills in terms of the technical skills, but you are also going to be facing a lot of people sort of challenges, because in our profession, the clients change every 30, 40 minutes, and different expectations every 30, 40 minutes, sometimes even younger, reset all the time.
Yeah.
And, the support staff, the patients, everybody wants you to be like someone else, because they are used to someone else who is more experienced than you, and their style is more comfortable to the way they deal with things. So they want you to be that person. Sometimes it's direct comparison, other times it is indirect comparison. So it's very hard for young clinicians. And it happens to us being experienced as well to some degree. And I guess from what I can say is that the way I categorize my patients is, roughly speaking, there are 3 types of patients we normally get in our chairs.
Yeah.
The first type is the one who's had the best experience in past, with their healthcare provider.
Yeah.
Okay. And when I say patient, I'm talking support staff as well here. Okay. So they loved the person who they worked with, and patients loved the clinician.
So they have a
positive association with this relationship.
Yep.
The second type of patient is complete opposite, which is they hated the person or the experience and everything about it. And the third one is more neutral. Now, the neutrals are easy to deal with because you have you have a free hit, because then you can just be yourself and then you establish the relationship accordingly, because the person on the receiving end doesn't have any specific expectations. So you can deal with that very easily.
So they are the feel-good patients, right?
Yeah.
So you walk away with nothing.
Yes, that's correct.
Yeah.
Okay. So they are the easiest ones to deal with.
Yeah.
Patients or support staff.
Yeah.
The first one, which is the ones who had the amazing experiences with the person that they dealt with, it's a good thing because when they're going to compare you with them, with this person, it's like if I take the example of, let's say cricket, for example. So I'm a young cricketer and I'm the person, my, let's say, audience in this case is expecting me to be Sachin Tendulkar or Virat Kohli or Brian Lara.
Yeah.
Now, it scares me, as
Because
a
you're
young
being
cricketer,
compared.
that
Yeah.
I'm being compared to this greats of the game. But at the same time, it gives me a comfort that deep down, they see some potential in me that I can be the next Sachin Tendulkar.
You have the capability.
I have the capability.
Yeah.
So there is a good expectation. Like
Yeah.
I would be worried if they look at me and just compare me to someone who no one knows.
Yeah.
So from that point of view, you can spin it, or I certainly do. That,
A good problem to have. Yeah.
So it's a good problem to have that I'm going to, okay, there's a high expectation of me.
Yeah.
So I can really try my best. And if I win it, then I've got someone who really admire me.
Yeah.
Right?
Yeah.
So that's that.
Yeah.
Okay. You still go slow with these people, these patients, because again, they have this relationship where they were so happy. So you have to just understand what made them happy about the way things were. Similar to Josh scenario, that there were certain things you liked about Courtney, and as long as Josh understands what those things were, then he actually has some reference to work with.
Which
right?
he did. So
That's exactly
he
right.
removed the meeting links for me. I can just call him now.
Call him up, yeah. So that's the easy one, right?
Yeah.
Not easy one, but comparatively easy one compared to the second type of patients we get.
Yeah.
And that's the one who don't have anything nice to say about their past experiences, the treatments or outcomes or anything.
And Jimmy, these are genuine patients who haven't had good experiences in the past.
Of course.
Yeah.
Look, most of the time these are genuine people
Yeah.
because they, something didn't work out for
course.
them. There are also the patients who generally are high demanding, and then doesn't matter
what you do,
what we do, they still walk away, or at least they have a perception that they didn't get the right outcome. But that second category, my first reaction, and this is what I tell, and I know you say the same thing to all the young clinicians that we work with, is that as soon as you realize the patient didn't have the right experience in past, the first thing is acknowledge and apologize on behalf of our profession, because
because dentistry has come a long way. It wasn't pleasant.
And the reason for apologizing is not because I did something wrong. It's because, like, as I gave the example of Sachin Tendulkar, and so Sachin represented cricket, like Roger Federer represented tennis.
Yeah.
We represent, and everybody in our industry who works in the dental industry represent the industry. And if the client did not have good experience within our industry, then whether we were directly involved or not, we to some degree are responsible for it because we make the industry.
Good.
So from that point of view, my first reaction to these patients is that, okay, I acknowledge everything that you say and I apologize for your experience. And that straight away breaks the barrier in the sense that, okay, all right, I have someone is listening and someone acknowledges my pain or my misery, okay, and then willing to work on it.
Yeah.
Right? One of the young clinician asked, okay, why are you apologizing, for
why
something?
Should we apologize?
For something that we haven't done. And my explanation was very simple, because what did I lose here? Nothing. My ego is not coming in way to say that, okay, we as a profession could have done better. And that gives my patient that, okay, this person is willing to work with me.
Yeah.
And by doing that, you straight away break the barriers. And I remember, I think when we first moved to Australia, there was this apology from Kevin Rudd, which was a pretty
In
big
2008.
big deal.
Yeah.
And that sort of stuck with me that, okay, this is a great way to start and heal the relationship. And so that's how I start with that second category.
Yep.
That, okay, I acknowledge it, and then from here on I can only try my best to sort of give you a different experience.
Yep.
And then everything else, just as we discussed earlier, the communication, the empathy, the care, the execution, post-op, everything has to go according to the plan as well. So yeah, that's how I sort of go about these three categories. And the young clinicians, they just have to again understand that the comparison is there. Whether it is a good or bad comparison, it's going to be there because they are new. They are new face in the industry, but they just have to make it work for themselves. And again, be true to yourself, be honest to yourself. Work on your technical skills, because again, you're not going to be able to execute everything at 100% from day one, because that's a constant progress. But control the controllables, and not get sucked into
The
negativity of the words, because sometimes, you know, your patients or your support staff is going to say something or do something that will make you feel like, oh, I'm being compared. But that's the reality of the situation, and you just have to keep your head down and then just control the execution and the communication, and it will just flush itself out, where they will accept you for who you are, and start liking you as a new norm. Yeah.
I think, like, I feel exactly the same. I think slightly like different, but same, but different. So as in, I usually just, when I look back, Jimmy, if somebody had told me these two things, that skill is not going to come overnight. You will have to really hone that skill over years. That's one. And the second thing was that patient relationship, patient communication, those things are also going to take time, right? And I think those two things run parallel to each other. And unfortunately, you do some really dirty reps.
Of course.
During that. And that is the steepest of your journeys, the first few years, 5, 6, 7 years. And I think one thing that if I would tell my old younger self would be, as you are going through this journey, try to separate you from your ego.
Of course.
Because that's where we take everything personally. We want to reply back to them. We want to give it back to them, whether it's support staff. And you spend so much negative energy in this, and you never get to focus on honing your skill or getting better at your communication. The ego, you just go on this ego trip, right? Like, did I do that procedure wrong? Did I say that? Did they point it out at me? I wasn't good enough. That I trip, it just distracts you from the whole job.
So the ego's job is to protect us.
Yeah.
You know, at all costs.
Yeah.
And, you know, when someone's telling us about bad experiences they had in past, your ego straight away separates you and said, you didn't do it and you're not going to do it.
No.
So, you know, it's not your problem. Same goes with things that you did and things didn't go out to the way you planned it. And now someone's pointing it out or blaming you for that. Same thing. You always have a reason why it didn't go to the plan. So in any of those scenarios, ego is just trying to protect you. Again, it's easier said than done,
of course,
to separate your ego from
Absolutely.
Yourself.
And I think you have to go on your own life journey to figure that out.
Yes, so you have to really go through the journey of really keeping that separate from your day-to-day life, that okay, you know, this is what it is, and then I can only just focus on the good side of the story and the controllables, and not let the ego respond, because the moment the ego starts responding, usually the outcome is less ideal.
Yes, that's right.
Yes.
Yeah. And I think that's where I think Josh won. Like, he won to the point that he did not let ego come in the way.
Yes.
And hence that is why he's in HR, because he deals with people. He could
Yes.
see that I was struggling with with change.
Yeah.
And I think he just stuck at that, just kept doing what he was meant to do. And guess what? I'm actually now worried that what happens if Josh leaves?
Let's hope he doesn't.
Yeah, I just hope he doesn't. Yeah. So thank you, Jimmy.
Thank
And I
you.
think to wrap up today's episode, I think this is what you were saying, that to all the Courtneys, Joshes, and all the health professionals listening to us today, that if you turn up to work today and somebody says to you that where is my old dentist or doctor or physiotherapist, keep your shoulders up high and just show up and get the job done and move on and think positive about the whole thing. Your day is not far.
Yes, I think it's let your true character and your work speak for yourself. Don't get sort of tangled into um, the negative remarks and all that type of things. Yeah.
Yeah. So be Josh.
Be Josh. That's correct.
Thank you. Let us know if you ever found yourself in a scenario where someone wanted you to be Courtney, or share your being Josh stories with us. Thank you for listening. I hope you got something out of it. Don't forget to follow us on Instagram or subscribe on YouTube.